Good evening. My name is Rohit Khanna, and it's a pleasure to be here tonight. So tonight we're going to talk about the big D, the D word, disruption. And I think it's fair to say that most people, when they think about disruption, they think of it as a positive thing. When you think about disruption in your life, the products, the services you use, generally they make your life better. And the same is true in my environment, in healthcare. Today, we have accelerated drug discovery and bench research using disruptive artificial intelligence and deep learning algorithms to bring medicines to the market faster than we ever could before. And today we have pills that you can swallow that have sensors in them that will tell your doctor when you've taken your medicine. Today, we use liquid biopsies to treat cancer patients and monitor their tumor growth, no longer needing tissue biopsies, which are incredibly invasive, onerous, and expensive. And if that's not enough, we are on the cusp of soon being able to three-dimensionally print tissue and human organs and successfully transplant them into Canadian patients. So it's all good. Disruption's positive. But what about negative disruption? How come we never talk about that? How come we never acknowledge it? How come we ignore it? It stares us in the face every day. But seriously, tonight I want to have a conversation with you, an honest conversation about negative disruption. And I'm going to talk to you about negative disruption from a healthcare perspective. And I'm going to frame it in the context of healthcare fraud. Now, not a lot of people talk or think about healthcare fraud, and not a lot of people think it's disruptive. But in case you're skeptical, let me give you some context. So healthcare fraud is by far and away the most prevalent form of data breach, fraud, identity theft in this country. Far and away. And it costs us $5 million each and every time a data breach happens. Now, you might be thinking, well, $5 million for the government, for these publicly traded companies, that's not a lot of money. And maybe you're right. But when you're third in the world, in the absolute number of data breaches, it adds up. 60, 80, 100, 200. Millions become tens, which become hundreds, which become billions. So our data is not precise around healthcare fraud, but reasonable estimates suggest that about 6% of total healthcare spending goes towards fraud. $14 billion a year, $37 million a day, in the time it takes you to listen to me and my colleagues, shuffle your way out of this auditorium and grab a glass of wine, $1.6 million of fraud will have been committed against the Canadian healthcare system. Now, you might wonder, why am I using these terms fraud and identity theft and data breach interchangeably? Why am I conflating these issues? And hopefully this schematic will help you. So if you look at the right-hand side, that's where we want to focus. We want to focus on disruption. And disruption has a fingerprint. It has a DNA. It has a hallmark. Disruption makes things that make old things obsolete. Disruption makes things that make old things obsolete. So what did healthcare fraud used to look like? It used to be doctors billing for services they never rendered. It used to be doctors billing for uninsured services like they were insured. In extreme cases, it used to be doctors billing for patients that didn't even exist. And to be fair, patients are culpable too. It's not just a supply side issue. Patients crossing out dates on insurance forms, moving decimal places to squeeze in a claim before the end of the year. That's healthcare fraud. And so, if we understand disruption, and we understand that it makes old things obsolete, we can then understand that disruption today is cutting edge. It is high tech. It is advanced. You have never seen anything like it. Let me give you an example, a hypothetical example. Let's say there was a small to medium-sized city on the eastern seaboard of North America. Let's call the city Boston. And let's say this city that we call Boston, let's say it had a very famous event every year. Let's call it a marathon. And let's say that one year there was a tragic event at this marathon. Let's call it a bombing. And let's say that the media, doing their job, covered this event, these heinous acts, 24/7, wall-to-wall coverage. And in doing so, they told us about the Tsarnaev brothers. They told us where they lived, when they were born, where they went to high school. They interviewed their friends. They talked to their family, including their unmarried maternal aunt, which will make sense to you in a minute. And let's say that there were some nefarious people sitting in Boston, or Brussels, or Bangalore, or right here in Brampton. And let's say these people started to put the pieces together. And they said, wait a minute, wait a minute. I know their first names, I know their last names, I know their date of birth, I know their address, and because you interviewed their maternal unmarried aunt, I know their mother's maiden name. And what if they went and got a social insurance number? Or worse yet, what if they went online and reset all the passwords that linked the bombers' accounts, credit cards, bank accounts, student loans, car loans, and for all their contacts? Now, I know this is hypothetical. I know it's a little bit sci-fi, it's a little bit Orwellian. Or is it? In the first 12 hours after the 2013 Boston Marathon bombing, the Massachusetts health system had to shut down and lock down the Tsarnaev brothers' password reset accounts. This stuff is happening today. This is disruptive. It is no longer moving decimal points, changing dates, billing for services that you never rendered. This is cutting edge. This is high tech. And we need to pay attention to it. Because like most things that are disruptive, it's just the tip of the iceberg. Thank you. Good night.